This is Ann Hines. I'm the board president of North Carolina Integrative Medical Society. I'm here today to introduce one of our participants or presenters at the Southeast Regional Integrative Medicine Conference, June 9th and 10th in Raleigh, North Carolina. My guest today is Dr. Stasha Gominak, neurologist, sleep specialist, and author of the Right Sleep Protocol, which is a paradigm-shifting and potentially life-changing program for people with sleep difficulties. I myself attended a Right Sleep workshop 2 years ago, and I must say that I use the pearls that I gathered there on an almost daily basis. I treat my children with autism by testing B12 levels, vitamin D levels, trying to correct the microbiome, all of which help sleep. And of course, these patients are notoriously poor sleepers. So I'm very grateful to Dr. Gominak for having helped me with that foundational problem. Dr. Gominak, what prompted you to shift your focus to sleep medicine?
Anne, I am now going into the 12th year of this. I shifted into sleep medicine from general neurology when one of my headache patients got better with a CPAP mask. And I really didn't think that that was something that was going to happen. I would never have thought to center for any sort of sleep study. And following that, I did many sleep studies on young, healthy women, teenagers, a few men who were seeing me for daily headaches. So it was the entry was, could it be that if this one person got better with a CPAP mask, that sleep and headaches could be linked? And the answer is yes. And then the outcome after quite a bit of study was that all of the patients had abnormal sleep studies, though they did not have apnea. And what I'm going to teach you about at the lecture you're going to attend is that there is actually a chemical problem, a brain chemistry deficiency state that comes from moving indoors. So when we moved indoors, starting in the 1980s, at the direction of our dermatology colleagues, we started the vitamin D deficiency epidemic. That epidemic surprisingly affected our microbiome because it turns out that D is one of the necessary growth factors for having a normal microbiome, and it was naturally set up so that you would have a summer microbiome and a winter microbiome. And those deficiency states that result when your microbiome changes are at least the 8B vitamins and probably multiple other things that we're going to discuss at length. So the multiple diseases that have become epidemic in the last 40 years, including sleep apnea, fibromyalgia, chronic fatigue, autism, ADHD, and the rising incidence of things like prostate cancer and breast cancer, many of the autoimmune diseases are primarily linked to one, a combination of sleep disorders plus a vitamin D deficiency state, plus other deficiencies that we're just starting to clarify that come from losing the microbiome. That means that you have a potential road to correct these deficiencies, correct sleep disorders, and actually sleep better. And the most surprising discovery that I made was the brain keeps a record of every single deferred repair. Every repair that you don't have enough time to make, it remembers that. And if you give it time back into deep sleep by feeding the brain the things that it's been missing, it will actually endeavor to correct all the things that didn't get processed correctly. And it will actually repair your organs because we are self-repairing living things. I'm looking forward to meeting all of you and sharing this great information. I'm really looking forward to Anne talking about how this has made a difference with her clients as well.
Well, we're so looking forward to seeing you. And those of you who are watching, remember, Southeast Integrative Medicine Conference, June 9th and 10th, Cary, North Carolina. You still might be able to get an early bird rate if you contact me. So thank you so much, Dr. Gominak.
Thank you, Anne, for inviting me.
Okay, and I've got a special treat for you when you do come. Okay.